body's like that.
It really is. And sometimes doctors might recommend one more type of test, genetic testing.
Ah, so that's for the cases where there might be a genetic link.
Exactly. They're looking for specific gene mutations, the ones that are linked to a higher risk of SCA.
So it's like a deeper dive into the DNA.
You could say that.
Yep.
And it's especially relevant for people with a family history of SCA, or for people who've had, say, unexplained fainting spells or seizures.
Right. So genetic testing can help uncover those hidden vulnerabilities in the heart's electrical system.
Precisely.
And early detection is key, right? I mean, knowing your risk factors could really save your life.
Absolutely. Identifying those at higher risk allows us to take preventative measures.
Like lifestyle changes.
Yep. And in some cases, even medical interventions. It can significantly reduce the chances of SCA happening. It's all about empowering people to take control of their heart health.
That makes a lot of sense. So we know the causes and we know how to diagnose it. But what happens if someone actually experiences SCA? What's the treatment like?
Then it becomes a race against time. Like we said before, every minute without treatment counts.
You mentioned those survival rates plummeting earlier. How bad is it really?
It's a grim reality. If defibrillation happens within the first minute, the survival rate is about 90%. But if you wait 5 minutes, the survival rate drops to 50%. So those first few minutes are absolutely critical.
Wow, that really puts things into perspective. So what can be done in those first few minutes? What needs to happen right away?
2 things are absolutely essential: CPR and defibrillation. CPR, or cardiopulmonary resuscitation, involves chest compressions and rescue breaths.
To keep the blood flowing.
Exactly. You're manually circulating blood and oxygen throughout the body, essentially buying time until the pros arrive.
And I've heard that even if you're just a bystander, knowing CPR can make a huge difference.
Huge. Bystander CPR can double or even triple a person's chances of survival. It bridges that gap, between when SCA hits and when the ambulance gets there.
Right. And then there's defibrillation.
Yep. That's where you deliver an electrical shock to the heart, try to reset its rhythm.
Sort of like jump-starting a car.
Perfect analogy. So CPR keeps the blood moving, and defibrillation tries to get the heart back on track.
It's amazing how important those 2 things are. But what about technology? Haven't there been some really cool advancements lately, especially with wearable devices?
You're right on the money. Technology is playing a bigger and bigger role in managing SCA. One of the most exciting things out there is the wearable cardioverter defibrillator.
Wearable cardioverter defibrillator. That's a mouthful.
We usually just call it a WCD.
WCD. Okay, I'll bite. What is it?
Imagine a vest. It's got sensors that are constantly monitoring your heart rhythm, like a bodyguard for your heart, 24/7.
Okay, I like it. A bodyguard.
If it detects a dangerous arrhythmia, it delivers a shock automatically, even if you're alone, even if you're asleep.
Wow, that's incredible. Does that mean everyone at risk for SCA should be wearing one of these vests?
Well, like any medical device, there are pros and cons. The good news, 24/7 monitoring. And you don't need someone else to be there to help, which is huge because SCA can happen anywhere, anytime.
Right, but you said there are cons too.
Yeah. They can be pretty expensive, even with insurance. And let's be honest, some people find them uncomfortable, especially if they have to wear them for a long time.
Yeah, I can see that. Wearing a vest all the time, that would take some getting used to. Are there other options? Something for people who might need more long-term protection?
There is. For people who need that constant monitoring or are at higher risk, there's the implantable cardioverter defibrillator, or ICD.
ICD, okay, so that's like a WCD, but it's
implanted under the skin, so it's a more permanent solution. Still monitors your heart and can deliver a shock if needed.
So how do you decide who gets a WCD versus an ICD?
It really depends on the individual. Their medical history, risk factors, lifestyle, all of that. Someone recovering from a recent cardiac event, for instance, might get a WCD temporarily until they're stronger.
Okay, that makes sense.
While someone with, say, severe heart failure or a genetic predisposition to SCA might need an ICD for the long haul.
So it's a really personalized decision.
It is.
It's incredible how technology is giving us more and more options to protect our hearts.
It's amazing, isn't it? And the advancements just keep coming.
It's true. And speaking of advancements, we can't forget about a recent case that really brought the importance of SCA to light. Do you remember Ashata Nan?
How could I forget? That poor young woman. Her story really shook the world.
It did. Shatha was only 15, a rising star in the swimming world. And she had SCA during a training session.
It's just devastating. And it reminds us that SCA can affect anyone, even seemingly healthy people, even young athletes.
It's a reminder that this condition can be so unpredictable.
Exactly. Her story is a wake-up call, really.
A wake-up call for what?
For all of us, to better understand SCA, to get better at preventing it and treating it. We need more research, better detection methods, and more awareness. This is a silent killer, and we need to be talking about it.
I couldn't agree more. Absolutely. It's a tragic reminder that we need to be proactive, especially when it comes to young athletes. They might not show any signs, any vulnerabilities, but it can still happen.
It's a wake-up call for all of us, really. So where do we go from here? What can our listeners do? How can they arm themselves with knowledge, be more proactive?
Knowledge is power, right? Especially when it comes to our health.
You got it. Understanding the difference between SCA and a heart attack, recognizing those risk factors, knowing the signs, the symptoms, that's a good place to start.
So it's like Heart Health 101, back to basics.
Exactly. But let's dig into those risk factors a little bit. What are some things people should be paying attention to? What should they be looking out for?
Yeah, give us the rundown. What raises those red flags?
Well, some risk factors you can't really control, like your family history or your age, but there's a lot you can do with lifestyle choices.
Okay, so what kind of lifestyle changes are we talking about?
The usual suspects, really. Maintaining a healthy weight, eating a balanced diet, getting regular exercise, the basics.
Yeah, but those basics are important.
They are. They help control your blood pressure, keep your cholesterol levels in check. Those are major contributors to heart disease, which can then increase your risk for SCA.
It all ties together, so those are good reminders for everyone, really. Anything else we should keep in mind?
Quitting smoking. If you smoke, quit. It's that simple.
It damages your blood vessels. Really.
It does. Increases your risk of blood clots, too. All bad news for your heart.
Makes sense. So healthy habits like exercising and not smoking, those can go a long way in lowering our risk.
Definitely. But what about people who are already at higher risk? People with a family history of SCA or people who've already had some kind of cardiac event. What about them?
Yeah, what should they do?
For them, it's all about regular checkups and having open, honest conversations with your doctor. Don't be shy, Talk about your family history, bring up any concerns you have, ask about getting those tests, ECGs, echocardiograms, all that. Especially if you're having any weird symptoms, chest pain, shortness of breath, dizziness, anything like that.
So being proactive is key. Don't wait for something to happen. Go get checked out.
Exactly. Early detection is everything. The more we understand about SCA, the better equipped we are to prevent it. And if it does happen, to respond effectively.
So it's like building a defense system for your heart, layer by layer. Learning about the enemy, knowing your weaknesses, and then taking steps to protect yourself.
I like that. A good defense system. And just like any good defense system, it needs to be comprehensive. You can't just rely on one thing. It's about combining those healthy habits, the regular checkups, and staying up to date on the latest technology.
Speaking of technology, it's pretty wild how much it's changing things in the medical field. Remember those wearable defibrillators we were talking about earlier? The WCDs? It blows my mind that someone can just walk around with a device that could potentially save their life.
It is remarkable, isn't it? And research is constantly moving forward, so we can expect even more innovation in the future. Smaller devices, more comfortable ones, even more accurate at detecting those life-threatening arrhythmias.
It makes you wonder what's next, What if we could predict SCA before it even happens? What if your smartwatch could analyze your heart rhythm and be like, hey, something's not right here?
That's a fascinating thought. And honestly, it's not completely out of reach. Researchers are already looking at how to use AI and machine learning to do just that, analyzing tons of data, including heart rhythms, to figure out who's at risk.
Wow, that's incredible. It's a whole new era of personalized medicine. But until we get there, there's still so much we can do right now.
Absolutely. Empower yourself. Protect your heart. It's in your hands.
It is. So let's recap for our listeners before we wrap things up. What are the key takeaways from today's deep dive?
All right, here's the rundown. First, understanding the difference between SCA and a heart attack, that's crucial, both for prevention and for knowing how to respond in an emergency.
SCA is an electrical problem. A heart attack is a blockage. Two different things.
Right. And then we talked about the main causes of SCA, coronary artery disease, cardiomyopathy, those genetic abnormalities.
And knowing those causes helps us understand why it's so important to address those risk factors. High blood pressure, high cholesterol, smoking, all that. Healthy choices make a big difference.
They do. We also talked about the importance of early intervention, CPR and defibrillation, especially in those first few minutes after SCA. Those can literally be lifesavers.
And don't forget about the power of technology. Wearable defibrillators, implantable ones. It's amazing how far we've come.
It really is. Technology is transforming healthcare in ways we never could have imagined.
It's true. So there you have it, folks. A deep dive into the world of sudden cardiac arrest.
It's been a pleasure sharing this information with you all.
And thank you to our expert for joining us today. We hope you learned something new, and we hope you'll take this information to heart. Literally.
Yeah, it's been quite a journey. We've talked about everything from those hidden risk factors to those incredible wearable defibrillators.
And you know what? For all the progress we've made, there's still so much we don't know.
That's true. It's kind of humbling, actually.
Yeah.
And exciting. So many mysteries left to unravel.
Absolutely. And speaking of unraveling mysteries, remember earlier when we were talking about AI?
AI and predicting SCA? Yeah, that blew my mind a little bit.
Imagine, right, your smartwatch analyzes your heart rhythm and it's like, uh-oh, heads up, there might be a problem brewing.
Straight